The purpose in doing these meetings is to make you so strong, so knowledgeable, so informed that no one can mess with you. I don't want anybody telling you that you're damaged goods. I don't want anybody telling you that this is your fault. I don't want anybody telling you that this is all in your head, nor do I want anybody telling you there is no hope. Nor do I want anybody to tell you that you have an incurable bladder disease, because remember, we now believe that IC is neuromuscular for about 80 to 85% of patients. The patients who have bladder disease are going to be the patients with Hunner's lesions caused by viral infections, or patients with active UTI. But for the rest of us, as identified in our AUA guidelines, they simply don't find bladder disease in the great majority of IC patients. And of course, that's really, really confusing. That's super, super confusing, because you're like going, but wait, I'm peeing all the time. How can this not be a bladder disease? Well, there is a condition called myofascial frequency urgency syndrome. What does that mean? That means that urinary symptoms of frequency, urgency, and pain can be caused by muscles and fascia and nerves. So most of us are in the myofascial frequency urgency syndrome. Now, you guys may remember, here, hold on a sec. Let me grab this phone for a sec. I get great messages from you guys. I get great messages. You know, you can call the IC network, and believe it or not, it goes right to one of my cell phones. Yes, I have 2 cell phones. I got an amazing email today, from a message today from somebody, and if you're watching, honey, you know who you are, but I'm not going to say your name. You are an anatomical mystery to be solved. It's very confusing when they look in your bladder and they see nothing, and you're like going, what? But you still have symptoms. I remember I was working with a patient years and years ago. It was so interesting. She had been diagnosed with Hunner's lesions, and she had video of it. Like, the doctor that had diagnosed her back east actually gave her video that showed her what her bladder looked like. And yet she moved across country. She came to California. She went to another doctor who looked in her bladder and said, oh, you don't have IC. IC's not real. IC's not real. And she's like, really? I'm good? And she really thought, okay, good. And so she walked out of the doctor's office really, really ecstatic, got in her car, was driving across the Bay Bridge, called me on the phone and said, Jill, guess what? I don't have IC. And I went, no, wait a second. You have a video of your bladder, and your bladder is, in fact, has Hunner's lesions. So how did the doctor explain your symptoms? And she's went, oh, you can't get caught up in a name. I mean, that's one thing. You know, that's a kind of one concept to remember. It's the name interstitial cystitis is kind of a danger zone, for lack of a better term. There are too many care providers who don't believe that it's real, or just don't know how to work with IC patients. And in this case, she went and saw a doctor who just didn't believe that IC was real. And he just told her, hey, you don't have a disease. And she was ecstatic until I went again, okay, but do you have bladder symptoms? She said, yeah. And I like, how did the doctor explain your bladder symptoms? She's like, oh, good point. So she's part of that 5% of patients who have Hunner's lesions. Now, for the rest of us, it becomes quite an anatomical mystery. So I was working with a patient a while ago who, when they looked in her bladder, she had a normal bladder, but there was something pushing into her bladder, and they could see it on the cystoscope. She had a bump, like a lump pushing right into her bladder wall. It's undeniable. Doctor saw it. What is it? Well, one of the well-known causes of bladder symptoms can actually be a fibroid tumor. Now, a fibroid tumors are interesting. Oh man, I got some pictures. Oh, where are my pictures? Where did I put my pictures? A fibroid tumor is a benign growth found in the uterus. And it can be, okay, so here's the side of your uterus. It can be on the inside. It can be a little lump directly on the inside of your uterus. It can be through the uterine wall, or it can be on the outside of the uterus, attached to the uterus, but on the outside. And when it is, and then of course it can be on the front side and it can be on the back side. So if you have a fibroid tumor on the front side, that has the potential of influencing the bladder and causing some of these bladder symptoms. And so I got a message today from a patient 3 days ago, she had her hysterectomy. And what did they find, my friends? Not only did they find a fibroid tumor pushing on her bladder, and of course the research shows that when you remove the fibroid tumor, the bladder symptoms get much, much better. So things are going there. The other thing that they found is that she also had a prolapse. And that's one of the other things that we know can trigger urinary symptoms. And they did not expect to find a prolapse. They found a very, very significant prolapse. And let me see, what did she say here? 3 days post-op, partial hysterectomy. What did she say here? I'm so thankful I found you because you actually got me to do my homework when no one else would listen to me. You would not believe the bags of medicine that I had that were thrown at me because no one wanted to listen to me. It kept saying I had IC and needed to learn to live with it. Even my OBGYN doctor that did the surgery a year ago told me to pick my battles when I would tell him how much pain I was in. Not only did he remove the fibroid, but he also noted a significant prolapse that he fixed while I was in surgery. Not one time did he mention that to my family when he came out to talk. And she appreciated my educating her. So anyway, honey, if you're watching, I'm so, so happy for you. You're over the worst. You're 3 days post-op. Now listen, for anybody who's had a hysterectomy, you got to understand this is a long recovery. Those are sutures that are viable sutures for at least 3 months. You cannot lift anything. Like literally, I bent over 6 weeks post-surgery and picked up a t-shirt and I ruptured a suture and I had a gush of blood out of my vagina because of that. So follow those instructions. I was working with somebody else last week. They told her she could return to work a week after hysterectomy. That's not well, it's hysterically inaccurate and bad. But she did. I can't even begin to imagine the pain she must have experienced trying to work after a hysterectomy. My God. One of the biggest surgeries, there are 2 big surgeries. I've had both of them that you can do to a woman, have a hysterectomy and have a mastectomy. And so anyway, getting back to the concept of you are an anatomical mystery to be solved. Maria, hold that question. Okay, so I want to talk about another patient that called this week. I was a mother of a patient. This was fascinating. 13-year-old, severe IC symptoms. And when they looked in her bladder, they found not 1, not 2, not 3, not 4, not 5, not 6, 7 lesions in her bladder. My God, that young girl was in agony. So again, for the 5% of patients who have Hunner's lesions, is that a disease process? For a lot of you, it is. And the very first thing that we look for is a viral infection, specifically the Epstein-Barr virus. And so as we were going through, as I was talking with her, because listen, I am going to do everything I can to help any parent with a child with IC, because I was a child with IC. Anyway, so we're going over the known causes, and I bring up Epstein-Barr. And I say, so have you had any mononucleosis in your house? And it turned out, yes. Her sister a year ago, or a year and a half ago, had a very severe infection of mononucleosis. And of course, now we have found the mononucleosis virus, Epstein-Barr, in the urine of some patients with Hunner's lesions. And so I truly believe, and she didn't know any of that. We sent her back with more information. I truly, truly believe that the way Epstein-Barr manifested in her body was to create lesions, whereas for some others, it creates very, very severe fatigue and lung issues and all sorts of issues. So that was another fascinating case of IC that we worked with this week. God, I worked with so many patients this week. You guys are keeping me busy. Let me tell you, we did a lot of coaching this week too. Well, I'm sure I will have more stories, but let's get, okay. So, hi, Jennifer. Okay, so you guys on YouTube, just so you know, the YouTube stream was compromised and we had to restart it. And I don't know if it's working or not. If it is, would you please write something and tell me? I have no clue what's happening with YouTube. It's very weird. Okay. So last week, we very briefly talked about the role of allergies. And I wanted to bring that back up today because I had a few people reach out to me after I did the meeting where we were talking about this a little bit more. So the first time I really heard about this was with Dr. Lowell Parsons. Lowell Parsons was one of the top IC doctors for many, many years. He was at UC San Diego, and he noted that many of his patients flared during the Santa Ana winds in the summer and fall. Santa Ana winds are winds that come from the desert and go to the ocean, and they can be 100 miles an hour. A lot of the big fires down in Los Angeles are driven by Santa Ana winds. Well, what else just winds pull up? Pollens. And I can remember the first time I met him, we had a conference up here and he was my guest speaker. And we were having dinner together the night before. It was a whole group of us having dinner. And he leaned over to me and he goes, Jill, do you have allergies? And I went, yeah. He goes, you got to try hydroxyzine. We think it really helps. And I'm like, okay, I'm in. I'll give it a shot. And what amazed me is, so number one, I did get a prescription of hydroxyzine. Prior to that, I had what I call sick all over days. I had days when I simply felt so ill that I really couldn't do anything. Now, you asked me why I felt ill. I couldn't tell you. Did I have a bad stomach? Not really. Did I have whatever? I couldn't tell you why I felt so bad. I can just tell you I felt miserable. And I'm not talking emotionally. I'm talking physically. So when I first, and I cannot take traditional, I can't take anti-decongestants, anything with ephedrine, because they make my heart race, and I've got a really sensitive heart. So I've just kind of stayed away from all of those seasonal allergy meds. But the hydroxyzine looked really interesting, so I decided to give it a try. And the first thing that happened is my sick all over days virtually disappeared. I mean, one week I had 5 or 6 sick all over days, and this was, going like the year my IC started, where I just felt so incredibly ill. A week on an antihistamine, and I went to having maybe 1 sick all over day all week instead of the majority of the week being terrible. I thought that was really interesting. So why is the bladder so responsive to allergens? Well, because the bladder has mast cells. you know? And when the bladder wall gets irritated in a variety of ways, those mast cells get triggered and release histamine. So allergies themselves, whether you have hay fever, you may notice that you're going to flare during allergy season, and that allergy response can be a systemic response, and it can trigger some bladder wall irritation. The other way that mast cells get involved in triggering IC symptoms is when you just irritate the heck out of your bladder. I have a really good picture that explains it. Oh, let's see if it's in here. Hold on. All right. Super casual today, guys. I'm super casual today, just so you know. This girl is not dressed up at all. I had a long day yesterday, so I'm being mellow. Okay. Now this is going to be interesting. I want to hold this up. Okay, so the question is can you see this on Facebook? Hold on. Okay, y'all can see this. Okay, so the etiology of IC and what happens when the bladder is insulted. So let's just say you drink Dr. Pepper, a really strong drink. What is that going to do? That then damages the bladder wall. We call this epithelial layer damage. So what happens then? Urine, and particularly potassium, now enter into the bladder wall where it was damaged. So urine goes where it's not supposed to go. What does that then do? That then activates nerves, specifically C fibers. C fibers are pain nerves. And when these nerves get activated, they release something called substance P, which is very damaging. And then after that, what happens? Hello, mast cell activation and histamine release, which then causes more damage to the bladder wall, which then creates more of a bladder insult, which then creates more epithelial damage, which creates more urine leaking where it's not supposed to, which irritates more nerves, etc., etc. And you can see here, this was kind of one of the first ways that we tried to validate treatments. So to help prevent the epithelial damage, this was back when they used Elmeron. Of course, we don't do that so much anymore. To help calm the nerves down, we would do a tricyclic therapy, also known as a low-dose antidepressant. And to reduce the mast cell activity, we would do an antihistamine therapy with hydroxyzine. So basically what happens is you get stuck in this vicious cycle. And it's really hard to break out of this vicious cycle of the bladder being irritated, the nerves getting irritated, then mast cells getting irritated, which does yet more damage, and you're stuck in this vicious loop. And one of the reasons why they encourage patients, or have for some patients, to use an antihistamine is you can block that level of insult and prevent more damage to the bladder wall. Just like if you take a low-dose antidepressant, you can calm the nerves down, which are also provoked in damaging tissue. The challenge, of course, is that none of this is fixing anything. This is what I call chasing the symptoms. And we don't want to chase the symptom. We want to find the underlying causation. So if you, for example, so let me give you a reasonable scenario. Let's say you really have really bad seasonal allergies, and yes, you absolutely flare. then taking an antihistamine, total sense. Makes absolutely total sense. But if you have pelvic floor dysfunction and your bladder wall is healthy, what is an antihistamine going to do for you? Right? So we're kind of past that day where we just put every patient on Elmeron and antidepressants and antihistamines. I mean, that was the protocol 20 years ago, 10 years ago. We're really not doing that anymore. Today, we're focusing on underlying causation because we don't want you to spend a year or 5 years or 10 years on a medication that has no chance of helping you. We could chase the symptoms forever. We don't want to chase the symptoms. We want to find the underlying problem. We want to fix the underlying problem. And that's why we now phenotype. And remember, I use the pain system, 5 core phenotypes. We can go over that in a bit. So anyway, let's just get back to the concept of allergies here for a moment. So, terrible allergy year this year. I don't know, it's crazy year. It's like all the colds were more intense, all the flus were more intense, COVID was more intense, and holy mother of you know what, allergies, way more intense. My best friend has been struggling to breathe for the last 5 days. Her allergies are so bad. It's weird how we go through these cycles of mild years and big years. And in her case, she's not going outside right now. Her windows are closed and she's on a lot of meds. But her favorite place to go, and one of my favorite places to go, is pollen.com, where you can actually look at what's happening in your community. You can search it by zip code. For me, my biggest allergy trigger is junipers. Pine trees and junipers. And the junipers basically bloomed last week. And I was a mess last week. It was not pretty. I'm a lot better now. That couple of days of the big bloom, will put me on my knees. The second thing, of course, is you want to stay ahead of the allergies using an antihistamine if your doctor has given you one or an over-the-counter one. And the IC patient population, we prefer hydroxyzine. There are 2 variations of hydroxyzine. One is called hydroxyzine hydrochloride, also known as Atarax. The other is called hydroxyzine pamoate, also known as Vistaril. Pamoate is way better than the Atarax. Vistaril way better than the Atarax. The Atarax it's more junky because it's more generic, and a lot of patients appear to react to that. I know I took one Atarax and it made me very ill, but I could tell it was a sensitivity reaction, and so I asked my doctor for Pamoate, took that for 8 years, loved it. With hydroxyzine Pamoate, so hydroxyzine helps to reduce histamine activity in the bladder wall. It will help you sleep. You don't take it during the day. You take it at dinner time to help you sleep that night. If you take it during the day, you will be sleepy during the day. That is not good. So I generally took mine like an hour after dinner. I wanted a couple of hours in my system so that by the time I was ready to go to bed, I had a very nice kind of mellow effect going on. Hydroxyzine is also a medication that they sometimes give you while you're waiting for surgery. It just kind of chills you out. I didn't notice really any severe side effects at all. 2 things happened. Well, 3 things happened in the end. Number one, it's just a little bit harder to wake up in the morning. It's like you've got to break through this extra layer of sleep to get up. But once you're up, fine, no fatigue. At least I didn't have any fatigue. Number 2, it made me very heat intolerant. So before I was taking Atarax, Vistaril, sorry. I was taking, I was a tennis player. I loved 100-degree days. I love the heat. If it was over 85, I was sick. And so that heat intolerance with that type of antihistamine is real. And so if you happen to live in the deep south, it might not be the med for you. But if you happen to live in the north and your summers aren't terrible, it might be okay. It has what we call a beneficial side effect. It has a very gentle anti-anxiety effect. And I like that. I really like that because having IC that for the first couple of years was unsettling and scary and frustrating. It was helpful. The last thing to know about hydroxyzine is something called hydroxyzine dreams. There can come a time where your dreams become much more powerful, or not power, intense. And so if it is a happy dream, it becomes a joyful dream. If it is a sex dream, one case, I had a sex dream and I made love to an entire cast of cowboys in a movie. Hysterical dream. Oh my God, that was so funny. I don't remember the name, but I do remember the cowboys. And last but not least, if you have a nightmare, it becomes a night terror. And after 7-8 years, I started having night terrors. I knew exactly what they were. As soon as I stopped the medication, they went away. And they were not typical nightmares. They were very, very, very scary nightmares. Okay, Angie, hold that question. We'll get there. Let me just finish this little bit. During allergy season, please stick to an IC-friendly diet because the last thing you want to do is provoke your bladder even more. Make sure you drink plenty of water. You can try nasal sprays. I use Nasorel when my allergies get kind of bonky. I use a HEPA air filter, which I have going in the room where I sleep in at night. And most importantly, just like with any IC flare, you want to absolutely catch it as early as you can. Don't wait until it's out of control. And if you're really struggling with your symptoms this year, call your doctor, go see your doctor. They might want to put you on more meds, maybe. And if you're having trouble breathing, you might need an inhaler. I've used inhalers I haven't had to use an inhaler in the last 10 years, but I had to use inhalers off and on for quite some time. I think getting older has helped me specifically, but on the other hand, my best friend is really, really struggling. So if you happen to flare during allergy season, you are absolutely not alone. This is very, 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 very common. All right. So, oh, here we go. Diane said, hydroxyzine made me have terrible brain fog the next day. Maybe I should try less. I take 0.5 of lorazepam every night to sleep. Okay. So, I come from the school of lowest effective dose. Redhead, central sensitization. I am very, very sensitive. I have always been very, very sensitive to meds. I always ask for absolutely the lowest dose that they can do, and then I ask, can I cut it in half? Most of the time, I'm going to cut it in half, sometimes in quarters. And that's what I had to do with hydroxyzine. So, and Visceril comes in capsules. And so what they had me do is pry open the capsule, pour it in a half a cup of water, stir it up. So it was a nice, clear, smooth suspension because it doesn't dissolve in water. Pour a half of it out in pour it out in 2 shot glasses, 1/4 cup each. Down one, put the other in the fridge, and you've got it ready for the other. So that's what my doctor had me do to reduce my dose of hydroxyzine until I found it to the end. Okay, we have lots of questions. RD says the live chat will not open on YouTube. RD, I'm sorry, honey. YouTube is being weird. Come on over, honey. Come on over to Facebook, to our Facebook channel. I do not understand what's happening with YouTube because it's open for me and I could see you chatting. I just do not understand what's happening with YouTube today. All right. Let's see. Maria says, I'm in the worst flare I've had for so long, caused by my oral antibiotics, Flagyl, that I took for 2 days because my bladder couldn't handle it anymore. They were given to me for bacterial vaginosis, but I don't have the classic bacterial vaginosis symptoms. The vaginal culture was taken 2 days after my period ended, so I truly don't feel like it's bacterial vaginosis. Doctor said I could not treat. and let my body readjust. I had also been starting daily estradiol cream, which always irritates me at first. I think that added to this flare. And I'm entering my ovulation window, and ovulation always flares me horribly. I'm starting to panic, and I don't know how to stop this. Caused by my oral antibiotics that I took for 2 days because my bladder couldn't handle anymore. I guess I don't quite understand. Did you self-medicate with Flagyl during this flare? Or did it happen after you took the antibiotics? I mean, kind of the rule of thumb is we combine symptoms with test results. And so if you've got wicked symptoms and you've got test results suggestive of an infection, then we want to treat that. But if you have no symptoms, but they find that your flora is off in some way, do you treat that too? And I interviewed Rick, the founder of Microgen, and he said no. The decision to treat is really always driven by symptoms first, culture results second. So I'm confused with you, Maria. Can you tell us more about your flare? What are your symptoms? What are you struggling with? Tell us more about your flare. Hi, Diane. Donna says, I've been taking aloe vera for 3 months. Is it okay to take with bladder rest with aloe? Can I use pre-leaf if I take aloe and bladder rest? Can I add lactoferrin to all this? You could. I'm not a big fan of aloe anymore. We don't have a single published medical study that shows that aloe is effective for IC, research study. And so aloe acts to soothe the bladder wall. And so I think the place for aloe is in the context of a bladder wall flare. But it's not going to fix anything underneath it all because your bladder's not made of aloe. So using phenotyping here, we want to make sure we understand what's driving your symptoms. So let's say you've got estrogen atrophy, your bladder wall driven estrogen atrophy. So in that context, bladder rest or bladder builder or Cystomend or Cystoprotect are chondroitin-based supplements that are believed to coat and protect the bladder wall. So that makes sense to me. Pre-leaf makes sense, but you don't take it every day. You only take it when you're going to eat a risk food. It doesn't do anything for the bladder wall. What it does is it reduces the acid of any foods that you're eating. So they're not comparable at all. Lactoferrin, based upon the research study from last summer, which was the best study I think we've ever seen with a supplement, acts to boost your immune system, and it has antibacterial, antiviral, antifungal effects. And so of everything you're taking, the one I would throw away would be the aloe, and I would do the other ones, or I would save the aloe for moments when you're having flares. But I'm not a fan of adding more and more and more and more. I mean, you're a company's dream because you're going to buy a lot of supplements. But I don't think that that's the right thing to do. God, yeah, gosh, I think I said this last week. I was working with a patient. Yeah, man. She'd been on Elmeron for years. She was doing 2 bladder installations a day, rescue installations, and she was on pretty much every supplement you could mention as well as more. And the thing is she was getting sicker and sicker and sicker. And she called because she wanted to talk about lactoferrin, and she was telling me what she's doing. And, my answer back to her was, man, you're doing a lot of stuff, but you haven't gotten better at all. She said, no, I'm getting worse. And I'm like, then why are you still taking all that stuff? Why are you throwing that money away? She was also, I mean, think about 20 years of a very expensive medication, 20 years of paying for installation supplies and catheters, and then all the extra supplements that she was taking, and yet, honestly, she was getting much, much, much worse. And when we were talking about phenotyping and I helped to phenotype her, she was clearly pelvic floor driven. And I was very blunt. I said, listen, have you had a pelvic floor assessment? She said, no. I said, that is the single most important diagnostic test now. That's like recommended in the AUA guidelines. Immediately, first appointment, we need to figure out if your muscles are tight. If your muscles are tight, we send you to physical therapy. And your money needs to go to physical therapy, not to all these supplements that are making you worse or all the other treatments that are making you worse. Listen, there is a place for supplements, totally. Especially if you don't have health insurance. I believe in supplementation. 30 years ago, I didn't. Today, I do. Absolutely. But you always have to be focused on, what am I trying to fix? As you're considering supplements and you're considering different treatments, you can't say IC. IC doesn't mean anything anymore. It doesn't. Most of the world isn't using the name interstitial cystitis anymore. IC is considered a pelvic pain syndrome for which there are many potential causes. So I want to go underneath that diagnosis to what is driving your symptoms. Do you have Hunner's lesions? Then yes, we need to treat the Hunner's lesions. Do you have estrogen atrophy? Yes, we need to treat the estrogen atrophy. Do you have tight pelvic floor muscles? 100% we need to treat the pelvic floor. My pelvic floor has been very angry with me this week. If you've got widespread pain, we need to treat the central nervous system. So we're no longer throwing the kitchen sink at this. Now it's a very finessed diagnostic workup and a very finessed individualized treatment plan. Diane said, I saw my new urogyne who did the steroid injections in my bladder and asked about testing for EBV, and she said they don't do that unless the steroid injections don't help. I was upset because I'd like to treat the possible cause of my Hunner's lesions instead of going into surgery every 6 months and have steroid injections. I don't know what to do. It was a urogyne's PA, physician assistant. She made copies of the research I brought in and said she would talk to the doctor. Go to your primary care. Ask your primary care if they'll do a test to see if you have Epstein-Barr. It's a blood test. Sandy said, okay, you know what? I'm shutting down YouTube. It's just not working. All right. YouTube is gone. Okay. So Sandy said the gastro and the doctor said it was a stomach virus and it flared up IBS and gastritis. Nausea off and taking enzymes, masticum, peppermint, ginger, probiotics when my guts have the stomach virus or IBS or gastritis that flares up my bladder causing urge to pee, gut and tight pelvic floor muscle causing bladder urge to pee. Working on the gut with your gastromate. Good. Yeah, this is really common. I mean, listen, if you've ever had diarrhea, like food poisoning or the terrible stomach viruses that are going around this year, and you're sitting on the toilet for hours and hours spasming, your pelvic floor is spasming while you're having diarrhea, you're going to notice you're probably not going to be able to pee well because those muscles are like this. Thus, usually you have to wait like 15 minutes after your last bout of diarrhea for the muscles to open up and let you release urine. So that tight pelvic floor during a diarrhea attack is real. I mean, I've had it myself. I'm sorry, Sandy, I'm sorry you're going through such a hard time. You know, and the gastritis is interesting. when you look at early IC research, and they were looking at the related conditions to IC, we knew all those studies assessed for IBS and found, like 40% of IC patients had IBS, along with vulvodynia and stuff like that. And obviously, men don't have vulvas, but men can get IBS too, IC too. What those studies never assessed for was stomach problems. And so about 10 years ago, as we had more and more patients who were talking about gastritis, I was like, you know what? We haven't done that. We should assess for gastritis and other stomach issues. And the data was shocking. I don't remember it specific. I can't give you the specific numbers, but like well over 50% of IC patients report episodes of gastritis. We also had a lot of GERD, and we had gastroparesis. Gastroparesis is delayed stomach emptying. So I went through 10, 15, 20 years ago, and it was like every summer, I would have a wicked episode of gastritis where I couldn't eat for like a week. And then I had to go slow. And then I was eventually diagnosed with gastroparesis, which is just the nerves in your stomach going very, very slowly. So I don't eat foods that are hard to digest. I don't eat, like, for example, I don't eat lettuce or spinach. Leafy greens really stay in my stomach way too long, and they start to ferment and produce gas. I eat a ton of salad. I just don't eat the lettuce. I eat carrots and all that other stuff just fine. So you're not the only one struggling with stomach issues. Donna said, my days are good. During the night, I have frequency as the pain gets worse before I empty my bladder. As the night goes on, urine is less diluted. I'm fine once I up. What's the best thing to do before bed to help the frequency and pain during the night? So nighttime symptoms are often a direct reflection of what's happened during the day. The reason why you feel your symptoms at night is because there are fewer distractions. During the day, there are a lot of distractions, and you might not notice that subtle frequency urgency building until you lay yourself down in bed and you go, oh, I've got to go. And then 15 minutes later, oh, I've got to go. So concept number one is, are you having a bladder wall flare from something that you've eaten or drunk that day? I was working with a patient this week who was very severe symptoms and okay, I've worked with several this week who are having symptoms. One of them was drinking coffee every day. The other one had started drinking matcha every day. And matcha is dried up green tea leaves, and green tea is agonizing in an IC bladder because it's a very strong acid, so no matcha. And then one of them called me on Friday, and she was having a terrible, terrible flare that day. Her bladder had been really good. She went out with a friend. They went to a coffee shop. She didn't have coffee. She had mint tea. Wicked, wicked flare. And I said to her, okay, let's be specific here. Was it herbal mint tea or was it mint green tea? And she went, oh, it was green tea. And she was paying the price terribly. So we have to look at, are you potentially irritating your bladder during the day? The same is going to be true with stress levels. It's going to be if you get super, super dehydrated, and also if your muscles are really tight. Heat, I would consider adding a heating pad. When you get into bed, bring a microwavable heating pad into bed with you, lay it over your pelvis, and let's just see if that heat can kind of chill things out. The IC Network has a fantastic heating pad. Oh, here it is right here. This is one of mine. I mean, I have like 5 of these hanging around the house. Right? And look at the shape is perfect. You see that? Look at that. This is called a ginger bee heating pad. It's made by an older woman here in where I live because I love to support local businesses and women who are working and men who are working too. This was originally designed as a neck heating pad. And so some of you, if you call or we FaceTime, sometimes you see me like this because my neck gets super, super tight with TMJ if I talk a lot. And then a lot of times I fold it like this. Like I fold it into a knot and then I use it. Oh yeah. I have a trigger point in my lower left back right now. Oh, it feels good. Yes, it does. Oh. Okay, that hurts. Okay, I don't want to do that too much. Okay. Angie says, help! Can you please show where the pudendal nerve is between 2 muscles just above the Alcock's canal? Doctors say I have a nerve compression from in between these 2 muscles. I'm using my wand. I want to be sure I'm at least in the right area. Honey, it's going to be kind of hard for you to do that. Let's see. Let me show you a picture of where you are, what you're trying to accomplish here. You would think I would have these pictures all labeled, and I don't, because there are just so many of them. I need to do that one day. Okay. Hold on, I'll find it. Usually the book just opens up right to it because I'm always showing it. Nope, that's not the picture I want. That's not the picture I want. Here it is. All right. Okay, you know what? I got to get the model first. Stay. Okay, just to show you where we're working here. So again, we're talking a pudendal nerve entrapment. Okay. Hello, pubic bone. Pubic bone. So this is the front of your pelvis. You can see your pelvic floor muscles through these holes. Hip bone, hip bone, hip bone, hip bone. We turn it around. We have your spinal cord, your vertebrae. We've got your sacrum, and we've got your hip bones. So you're going to notice here in your sacrum, there's 8 holes total. So the spinal cord comes down here and splits off, and nerves go through these 8 holes directly into your pelvis. That is the pudendal nerve. Oh, you guys don't need it. There. So now let's look at it from the inside. So we can see the nerves coming out of the holes. And you can see the nerves now going directly through, over and under the piriformis muscle. See that? So obviously if this muscle is tight, it's going to squeeze these freaking nerves. Then the nerves come together to go through what we call the Alcock's canal. That's underneath the ligament. And then when they get through the Alcock's canal, that's when they open up again and they innervate the entire pelvis from crotch throughout your crotch. So it's your piriformis muscle. So you need to talk with your physical therapist about what are the proper exercises for you to do. The problem here is that I think it's going to be, speaking as somebody who has a pudendal nerve compression myself, mine vibrates in my left butt cheek. If I sit too long, not vibrating right now, but I can, my left pelvic floor is not happy with me. It's definitely much more tender. Woke me up last night, as a matter of fact. So talk with the physical therapist about what are the right exercises for you to do, and how to use the one correctly on the pudendal nerve. And then at the same time, you really want to consider Peora, P-E-A-O-R-A, or P-Leaf, P-E-A-L-I-E-F, the palmitoyl ethanolamide supplements, which act to calm nerves down. But this book is the book to get for anybody with pudendal nerve entrapments. Breaking Through Chronic Pelvic Pain, Jerome Weiss, fantastic chapter on pudendal nerve entrapment. One of the things that they talk about specifically, you know what? Like literally, I just opened it up to it. So let's just go through a little bit of this real quick. So the pudendal nerve on both sides supply structures on either side of the pelvic with sensory, motor, and autonomic nerve function. It provides penile and clitoral sensation and controls the urethra and anal sphincters, the perineal muscles, and the skin and subcutaneous tissue in the pelvic region. It is the master of the sacral nerve family that innervates the pelvic floor and perineal muscles. Therefore, it can bring the whole family down when it is injured. So what are the symptoms of pudendal neuropathy or pudendal nerve entrapment? Pain with sitting. Pain can be experienced in the perineum, rectum, or clitoral or penile area on one or both sides. Pain is generally not experienced when sitting on a toilet seat as opposed to a chair. Pain may be less intense in the morning and increase throughout the day. Pain may decrease when standing or when laying down. You may feel a burning pain, experience burning or pain with or without touch on the genitals, perineum, or rectum. They may suffer from painful orgasms, decreased sensitivity, yada, yada, yada. Men can experience pain during erection, difficulty sustaining an erection, or painful ejaculation. You may have hesitancy, urgency, frequency, partial or complete incontinence, anorectal symptoms. You may experience constipation or have to strain to have a bowel movement. Or the sensation of a foreign object may be experienced within the vagina or the rectum. Where for me, when my pudendal neuralgia was really bad, it felt like there was a funnel inside my vagina. It's really weird. So what causes pudendal neuralgia? Direct trauma to the nerve inside the sit bone, often from biking on hard bicycle seats, sitting on hard or poorly designed chairs, accidents, falls, pelvic surgeries, or childbirth. You can have a stretch injury to the nerve caused by pelvic floor weakness, pushing during childbirth, chronic straining with bowel movements, or work exercises. And pain signals referred to the nerve from nerves in the sacrum and the low back, distressed muscles, organs, and surrounding skin, viral infections such as herpes. Okay. Just a fantastic article. As an example, here's a picture of a bike seat, and I want you to think about how that bicycle seat pushes directly up into the nerves. We call it bike rider syndrome. Anyway, this is important. Your normal nerve is round. But if you have a compression injury from a fall, look at what happens to the nerve. The nerve flattens. And when the nerve flattens, tissues are damaged. The nerve is damaged. Blood vessels supporting the nerves are damaged. That's a compression injury. And if you're sitting on a bike for a long period of time, that's what you're doing to those nerves.